Hello, everyone. My name is Jim Potter. Welcome to the TriNetX training session. I am on the team of trainers for TriNetX, which also includes Sumati Murli and Diana Gumitz. When you first want to access TriNetX, in your browser, type live.trinetx.com. You will then be prompted for your email address and following that for your JED ID. Once you have done that, you will be taken to the start screen for TriNetX. Let me share my screen and select TriNetX. So your start screen will not include any studies because you haven't yet created any studies, but we'll show the My Studies, and across the top, you will see a question mark. This takes you to the help screen. And in the help screen, you should check on that. Go to the training center, and in the training center, under TriNetX 101, there's an overview of TriNetX and a brief video to teach you how to use TriNetX. I recommend you watch this video and also the research and analytics webinar so that you learn how to use TriNetX research. When you're satisfied with your training on TriNetX, then go back to your opening screen, to My Studies, and you can begin creating a study. So let's create a new study. You must enter a study name. We'll call this COVID-19. Put my name on it, and you must select a research purpose. We'll just select to explore patient populations. Then at the bottom, create. So we have now created a query. Every time you run this query and count patients, it will save a copy of that over on the right. So I'm opening up that icon. I haven't named this. Let's give this one a name. I'm going to star it. When I do that, it means it will always be at the top. If I use the pencil, I can add a name. And that allows me to very quickly be able to find that query. And once I've created it with Johns Hopkins data, I can actually request the data set in the query from TriNetX, and I can get that sent to me free. Now, this is all de-identified data. There's no PHI or PII associated with this data. On the top screen, you notice that it says network, and I've selected Johns Hopkins. Let's click on this arrow to see what else is available. I could select TriNetX Research, which includes 44 HCOs online and 61.8 million patients. So we're staying with Johns Hopkins here. And with that, I can often also see when the data was last updated. So now that we have Johns Hopkins selected, it tells me that my queries are related to 1.7 million patients. Let's click on the pencil, and the pencil will allow us to see the demographics of these patients. So the patients go from birth to 89 in years. I'm going to select an age range. I only want patients above 50 years old, but I want all genders. So I'm going to save that criteria. And once I've saved that, let's begin adding the inclusion or must-have criteria. So I want patients with COVID-19, and ICD-10 code for that is U07. So I'll type that in, and U07 and the diagnosis code shows COVID-19. So I've added that. Let's count the patients. Oh, I haven't saved it. Good point. So you go to the bottom and add that to the query. So now that it's in the query, I can count those patients, and it will come up with 7,030 patients. Yet, if you look at this data here, it shows 13,340. The reason it went down was my exclusion of the population, so I'm only counting the patients over 50. Let's add another term, and let's look for, I'm going to use text, SARS coronavirus 2 and related RNA. So the data dictionary found the code very quickly. I'm going to select that code. This time I'll remember to go down and add that to the query. Now I don't want both, I want or. So select or, and now let's count the patients. So we now have 72,970 patients. Well, that's really a bit out of line with the diagnostic code level of 13,000. So if you scroll over SARS coronavirus 2, you'll see a funnel. This is the analytics filter. Let's open that. And you see it allows me to select an age range. So I want an age range from 50 to 89. And I also want to look at lab values. So it's looking at ever. I want only the most recent, and I only want the positive values. You see, if I took negative and unknown, I would be more than 10 times higher than the actual number of patients who tested positive. So I'll select positive, and now I will save these criteria. So now let's count the patients. Using both, I now find 8,690 patients. If I look over here, I can star this query. Let's give it a name, and we'll call it COVID-19. And once that's done, I'm able to request that de-identified data set from TriNetX and get that free. So let's put in a couple more terms just to show how the event folder works. So let's suppose we do not want patients who have uncontrolled diabetes, type 2 diabetes. So let me type A1C. And it quickly pulls up hemoglobin A1C total in blood. That's the code I want. So let's add that to the query. I get a histogram of the hemoglobin A1C. Now I can change this right here. So let's say I want a hemoglobin A1C greater than or equal to 9.5 to be excluded. And most recent lab result, scroll down, save that criteria. Now I may want to modify this. So I'm going to drag this to the event folder. And it drags to the left-hand side, which is the exclusion side. And I've done that because here I can add related events like body mass index, or I can look at time constraints. And here I want only hemoglobin A1C performed within the last 3 months. And let me change that. I don't want these anytime. So I'm going to select from today to 3 months. Okay, now we're set. Save. And we'll count the patients again. So we lost 30 patients who were type 2 diabetes with A1C above 9.5. So once we've done this, now we can explore our cohort. Let me minimize this so there's more screen to view. We'll go to the Explore cohort. Every time you make changes, you must run the Query Builder Explore cohort. So it's going through 1.7 million patients, and the results are now viewable. So here are the demographics. You see patients below 50 are excluded. We have the total number of patients, minimum and maximum age, the mean age, standard deviation, and information on sex, ethnicity, and race. Now, if at any time I want to keep this data and all data, not just what's seen on the screen, click on the camera icon, and you'll see here on the left, it will download the image for the demographics. Let's now go to diagnoses, and you see right arrows here that means there's data beneath that. They tell you the number of patients and the percent of the cohort that falls under each one of these diagnoses. So let's click on the arrow. You see bacterial infectious agents make up 81%. Let's keep drilling down. We have viral agents and disease making up 81%, coronavirus as the cause, other coronavirus, and there we are at the UO 7.1. As you go through this, you can look to see if there are other codes that you might want to include in your query, and that's the principal value I find in this. Procedures. If any procedures had been done on these patients, that will show up. Here, primarily procedures are evaluation and management services. We haven't included in any of the inclusion-exclusion criteria medications. So primarily what you find here are central nervous system medications, no specific medications yet because they haven't been defined. Lab values, and for the lab values, these are any time, but we can restrict it to within the last 3 months. Let's restrict. Now, because I did that, I need to rerun the query so I get to see those lab values just within the last 3 months. So there we have the lab values. We started with the metabolic panel, the complete blood count. I accidentally clicked on the platelets, but in doing that, you see the histogram for platelets, and you can now select value range. If I was looking at patients with liver disease, I might want to select those that had less than or equal to 100,000 platelets per microliter so that I wouldn't get patients with portal hypertension. So I want to cancel this. I'm not adding that. We can look at liver function tests. If I select alkaline phosphatase and ask to see the included LOINC codes, I could actually, knowing the LOINC codes for Quest or for LabCorp, select only the values from one of those 2 companies. I'm going to hide these codes. And if I was looking for only patients who had normal values for the alkaline phosphatase, I might want to exclude any patients who have an alkaline phosphatase above 40 units per liter, and add that to the must-have. For right now, I'm going to cancel that. Continuing down, there's a genomics icon. We do not have genomics at Johns Hopkins, but you may want to select that when you're using TriNetX research, because you will be able to get some genomics values, and you will be able to see the regional distribution of your query across the United States. Analyze criteria will show you where your primarily your exclusion criteria, how they impact on your overall query. I rarely use that, but if your query doesn't make sense, you may want to do that. Rate of arrival. I've found this to be very useful in a grant to perform endoscopic bariatric surgery on patients with biopsy-proven fibrosis. It was really important to see not just the number of patients, but how long it would take to get the number of patients we needed to complete the query. So rate of arrival can be very important. We'll show the graph for that. And because we've restricted our data to recent data, you see that the graph is showing just from the advent of the pandemic till now. We can look at summary statistics. And this is length of the patient record, fact distribution, facts by type. And you notice there's no regional distribution because we're only looking at Hopkins data. Now, if we continue down, in study management, you have a number of possibilities. So enter the study name. If it doesn't already show up, purpose of the research. Here on team, you can add members of your team. If you want the CCDA to provide PHI and PII on your query, that requires IRB approval and the inclusion of Bonnie Woods or a member of the CCDA to be added to the team folder so that they see the query and can understand your IRB protocol and provide the information you desire. Documents allows you to drag and drop documents to share with your team. If you have trouble with your query, you can request design assistance from TriNetX, and they will normally respond within 24 to 48 hours. Browse network. You have two today. We're on the network for Johns Hopkins. And so the browse network will be the same as what we've just seen. If we were using TriNetX research, then these would be related to the research queries. The big value, especially with TriNetX research, is the types of analyses you can do on the data that you obtain in your query. You can analyze outcomes, you can compare outcomes, compare cohorts, look at treatment pathways. You can do patient clustering, look at the burden of illness or incidence and prevalence. And all of this is at no cost and built within TriNetX research. Let me go back to the top. With the Trial Connect, if you want to be involved or included in any requests for participation in clinical trials that come from pharma or device companies, then you should notify Sumati Murli, and she will notify you of any trials that come in or that are in the area for which you're interested. When you first begin using TriNetX, I advise that you save all of your queries, clean them up later, remove the various queries that you will see. For example, here with queries I've run with Jerry Mullen's team, I've kept them all, but I could delete, for example, this is 23 HCOs in TriNetX research. I could delete that if I wanted to. For right now, I'm keeping that. If you have questions, you can contact me, Jim Potter. My email is jpotter@jhmi.edu, or pose your questions on the ICTR TriNetX website. Thank you very much.